Baby boy contracts COVID-19 in the womb. A study published on July 14 in the Nature Communications journal has detailed what doctors believe is the first transplacental transmission of the novel coronavirus. Doctors in France reported that a newborn boy's brain developed inflammation only days after he was born. The study involved the doctor's observations of babies diagnosed with COVID-19 who were believed to have been infected while still in the womb, though it is possible that they were infected during or after delivery. Danielle De Luca, co-author of the study and a medical director of the Pediatrics and Neonatal Critical Care at Antoine Beclair Hospital in Paris, said the case of the newborn boy is different. De Luca said, "Unfortunately, there is no doubt about the transmission in this case." On March 24, a 23-year-old woman was admitted to the hospital with a fever, severe cough, and abundant expectoration. She was diagnosed with COVID-19 after the virus was detected in her blood and in nasopharyngeal and vaginal swabs. 3 days after she was brought to the hospital, she had to undergo an emergency cesarean because her baby was in distress. Because the baby was affected by the general anesthetic given to his mother, he was kept in an isolated neonatal intensive care unit and intubated. Tests revealed that the virus was present in his blood and fluid from his lungs, but he was cleared of other types of infections. The doctors found out that the virus had traveled from the mother's blood into the placenta and infected the baby before birth. De Luca said, "Clinicians must be aware that this may happen and that it must be considered in the clinical workout. Doctors need to test the mother's blood, the baby's blood, the cord blood, the placenta, and the amniotic fluid before concluding that a newborn was infected with COVID-19 in the womb." According to De Luca, it's extremely difficult to get all these samples in a pandemic with emergencies all around. While the baby did exhibit neurological symptoms and signs of neurological injury, he has recovered and is clinically fine. The Centers for Disease Control and Prevention is not sure if coronavirus-positive mothers can infect their infants through their breast milk, but they recommend that mothers wash their hands often and wear cloth face coverings.